Good morning. Good morning. Welcome into our space. We are letting you in before we begin. Good morning, beautiful faces. Good morning. Hi, Bethany. Hi, Corinda. Hi, Shalisha. Good morning. Hi, Angela. Well, good morning, everyone. My name is Lisa Payton Kerr, CEO, founder, and president of the Foundation for Black Women's Wellness, and we welcome you all this morning to today's morning coffee conversation. COVID-19, surviving COVID-19, an urgent update. It is critical that we have this conversation this morning, and we are absolutely happy to know that you all felt the same in joining us. And I know we also have an audience on Facebook Live. And we've got two great speakers lined up today to really give us the information we need as we see a spike in cases in Dane County right now. But we'll jump into that in a moment. Again, Lisa Payton Kerr, here from the Foundation for Black Women's Wellness with Aaliyah Stevenson, our Chief Programs Officer and co-host, along with our team and our special guests, Tina Jones Savadogo and Janel Heinrich from Public Health Madison, Dane County. We welcome you to Morning Coffee on behalf of our organization, where our purpose is very simple: to empower a generation of well Black women and to equip you with the information, the tools, the inspiration you need to live your healthiest life. And that is our purpose today as we continue into several weeks of a global pandemic that is very real on the local level. And we felt it very important to shift gears this morning from a more inspirational topic to a critical life-saving topic of updating you and hearing your questions as we go along about the current state of our community and safety precautions to protect our lives as we see a spike in COVID-19 cases. But first, as we do each week, we'd like to highlight a small business, an African-American owned woman small business in our community. Aaliyah, would you like to share that information and we can drop it in the chat?
Yes, absolutely. Would love to. Thank you, Lisa. Today we're going to highlight Happily Ever After. It's a resale boutique owned by Marilyn Harper, located on Whitney Way, right here in Madison, Wisconsin. Gently loved children's clothes. They also buy and sell accessories, books, educational toys, puzzles, and more. Visit their website. Truly a treasure. I'm definitely going to be visiting myself with my 4-year-old. So yeah. It's beautiful. Check it out.
It is beautiful, and I've known Marilyn for years, but I've never been in the store because I don't have small children. But check it out, it's beautiful. And in fact, they really need our community support right now. COVID-19 has not only had health impacts, it's had extreme economic impacts, as we all know, and her business could really use our support right now. So check the link. There may even be a call for donations to help them stay open. So we felt it imperative to share that information with you today. A quick check-in for our audience here on our Facebook Live. We always begin with asking, how are you doing on a scale of 1 to 10? So if you can drop in the comments how you're doing, 1 being it's really a tough day, 10 being it's a glorious day for me. And I think a couple of us on this call said we've had a 1 week, but we're going to have a 10-day today. So wherever you are, we're going to elevate. And I'm sure the energy on this call will help elevate all of our moods and attitudes today. Please mute yourselves. I think you're already muted actually, but do please ask your questions as we go along. We have a lot of questions to ask. And as we start, I'm so happy to see 7s and 6s and 8-ish. And someone said, I'm a 2 to 3, but I'm rising. And that's all we ask for, is steady rising. So today we've got 2 exceptional guests on our call. And I want to thank you both again, Tina and Janel, for answering our call on short notice, right? Because we did shift gears to have this conversation today. Tina, super important to have you on as a survivor of COVID-19. And I want you to know how much we appreciate your transparency and willingness to talk about this publicly and to share it with people as you are home, thank goodness, recovering
Yes.
after a serious battle. And we'll talk about that in a moment. Tina is a mother, a Madisonian by way of Chicago, you all, and she's an entrepreneur and really a globe-trotting global entrepreneur who owns a company, Chief Executive Officer of MBE Consulting, an international special events, promotions, and public relations firm, and president of Journey of the Drums Productions, Promotions, Bookings, and Talent Agency. She's worked in global entrepreneurship for over 20 years, and she lives right here in Madison. And in fact, we'll talk, Tina, you were traveling back from Africa to the
Yes.
States,
Yes.
and shortly after.
Hello?
Lisa, I think we've lost your feed.
Hello?
We've lost your audio.
Hello?
Oh, okay.
There we go.
Let's see.
Can others hear Lisa?
No.
No. Okay.
I hear me now.
Oh, there we go.
You can hear me now?
Yes.
Okay, good. We're gonna take these off, throw them to the side. So sorry, you guys. Not sure what's happening with the connection this morning, but Janel, thank you for joining us. This is probably our third call with you. Janel Heinrich is currently the Director of Public Health, Madison and Dane County. She has worked in public health for more than 20 years in San Diego, Chicago, and now Madison. She's been the director of our public health department for almost 12 years, been a part of the department for 12 years and has been the director for 8 years. And her entire career has been committed to eliminating health disparities and advancing health and racial equity. And I'm a witness to that. We are proud partners with our Public Health Madison-Dane County organization. And we commend you, Janel. We can see the work, we can see the effort that everyone on your team has taken to protect our county and all of our lives. And we thank you and your team for that. We do. So without further ado, we are at a critical juncture in our county journey to beat COVID-19. Janel, you informed me this morning that we are technically 5 months and 1 week into the pandemic. And what prompted today's conversation is some very alarming data that has surfaced in the last week. There have been countless stories in the media about rising rates, new cases, a big surge in new cases that have really been traced and tracked to some very specific activities in our community. But just a bit of data that Aaliyah pulled for us yesterday. From June 13th through June 26th, 614 people tested positive for COVID in Dane County. And we know that 49% of those cases were young people between 18 and 25. 54% of those cases were tested at the public community testing site at Alliant Energy Center, which we encourage people to go get tested if you have not, and particularly if you have expanded your activity in the community. 45% of the cases interviewed reported attending a gathering or a party with people outside of their household. And a number have been associated with bars, a cluster of bars, and I think article. And you guys signal me if you have trouble hearing me because I'm getting a lot of messages about. Let me have you questions. Can you hear me? Yes, okay, good.
Yes.
So where are we, Janel? We're seeing a rolling back of some of the provisions as we started to reopen. Because of these spikes in number, the forward Dane plan has been amended, and we're hearing and seeing the need to taper back those activities. Where are we this morning?
Well, you know, we are in a different place than we were 5 months ago. We're in a different place than we were, excuse me, 3 months ago. and even a month ago, right? And we are learning more and more every day, locally, as well as the evidence emerges around nationally and internationally about just our knowledge about this virus. It's not going away, it's present. Locally, we have an incredible team of contact tracers, an incredible public health team in general, but folks who are just working so diligently on the contact tracing, following up with folks who are identified as individual with the diagnosis, and then the context of those folks, and a data team that really helps dig through everything at the micro and macro level about helping understand the context the data lives in. You know, we're seeing here, I think, the results of what's happening nationally, a bit of a fatigue for coronavirus, right? And, you know, it's hard. The things that we need to do to keep our risk of transmission low, to keep ourselves well, are things that keep us away from our friends and loved ones, right? And doing things that are more entertaining than crafting with our kids day after day, or whatever that might be for whatever your situation is. And I think people are you know, wanting to travel a bit more and be out a bit more, and that, along with what seems to be locally as well as nationally, a lot more young folks not recognizing the severity of what may happen, being largely less symptomatic than other folks. They're healthier, and going out and about, not wearing face coverings, and socializing in places that puts risk of transmission high and puts you into close contact with other people. And that is what we are experiencing. And the concern is how that has a ripple effect on our community. That's primarily driving our numbers, but we also know that we're seeing continuing to see disparities in positivity rates amongst folks of color, and that's of equal concern. Even though on a scale of what's driving this rate, this increase, it's not as the numbers aren't there. The disparity is not something that we want to be complacent to.
I'm glad you brought up that last point, Janelle, because we have heard about the spike in young people, and you know, there's two questions attached to that. I've got young adult children, and it has been challenging to keep them quarantined at the level that we think, that we know is safest. So first question, how do we talk to our young adult children who have lives? It's summertime, it's warm, it's hot, to help them understand the risk of transmission to their loved ones, knowing our risks, and also what are we saying that our community, specifically as African-American women and families, need to understand about the present and ongoing risk to us specifically?
Yeah, I think I will say one of the areas of opportunity that we have is figuring out how to message this young population better, and to get them to understand that they're part of a collective community, and that their behaviors have an impact on the folks that you mentioned, right? Grandmas, aunts and uncles, folks who may not have the same level of health that they do right now, and that their behavior puts them at risk. So we're trying to figure that out, and that we're not alone in that, right? But doing some more targeted messaging around that, and really that encouragement and building the understanding of the things that we need to be doing to keep that transmission low, that face covering and the distancing. I think that perhaps there's been some complacency around that. I think, sorry, Lisa, what was your next question just around for,
you know, I think you answered it. We really want folks to understand where the numbers sit today in our community. I know you all have started to, for several weeks now, track and disaggregate by racial and ethnic group. What does the African-American data look like right now in comparison to the population?
So I will say I have so many spreadsheets in front of me right now, because the data is just constantly evolving, and we're trying to make sure it's accessible and it's up to date in the moment. So looking through this from the age 20 to 29 age group for the month of June, the percent positive of folks in different communities are 10.4% of the cases are in the Black community, 71.6 white, and 8.6 Latinx, and then I could give you more. But I think, you know, that's important for us to think about and to know that it's happening everywhere, and that age group is you know, they're out and about. The disparity data is the three times higher cases in the Latinx community and 2 times that in the Black community than the white community.
And I think I read a statistic, you all, to put it in the framework of the national view, is that Wisconsin is 3rd in the nation for the highest disproportionality in COVID-19 rates for African-American folks. So we are in the top 3 states that are struggling most with the greatest disparity and impact with COVID-19 in our community. So we need to understand that as we live here and we have family and friends and we live in a broader community, of course, is we have to be vigilant not only in protecting what's happening in our house with our loved ones, but with, you know, all the folks that we're moving around and finding ourselves amongst on a daily basis, and being advocates, right? Being advocates for telling our loved ones to wear your masks, to continue to wash your hands, to continue to only go out to the store for essential reasons, and all those safety practices we must educate as we move, because this has real serious implications, which brings us to Tina. Tina, again, you have been personally impacted by COVID. We are so thankful that you are here to talk to us this morning, because as you all know, we've had real casualties in our community. We have all now come into knowing someone who hasn't made it. You know, there have been some funerals in the last few weeks, some losses that have been really hard and taxing on our local community. It's so very real. But the flip side, and Janel, I know that you emphasized this in a previous conversation, people are recovering from COVID-19 every day, right? Most people are recovering, but it's an ordeal, right? Tina, tell us your story. And just for background, it was just as you were coming back into the country, I think, that you reached out to me and informed me of your situation, let us know where you were, how you were doing, and asking about resources and supports, you know, for folks who are struggling in that way. How did it begin? You came.
Hello?
Yes.
What was the last part? I couldn't hear you. Hello?
Tell us about your journey, your diagnosis.
Oh, yes. Okay. I was en route from coming back from Africa to America, and I had to do a layover in New York. And so I felt like I probably contacted it in New York coming through the airport. Mm-hmm. And so I'm a strong advocate about not traveling via airport, because I feel like that's why I got my contact was in the airport. And so once I got here, I was 24 hours in New York, and then I was another couple hours in Chicago, and then Madison. And once I got to Madison, I went out twice. I was supposed to be in quarantine for 14 days once you travel in the air. You automatically quarantine yourself. So I was trying to do that as best as possible. And I'm like, well, I haven't been out, I haven't been around people, so most likely I got it at the airport. Only went 2 places when I came. I had on gloves and masks, and that was to Walmart and to Woodman's. The only 2 places I went. After that, I didn't go out anymore. So my contact, I felt like I probably got it via air travel. Mm-hmm. I started having symptoms around March the 27th, and then I was diagnosed on April 3rd. So they say it takes about 5 to 7 days. So it was about 5 to 7 days that I had been symptomatic. My symptoms were very peculiar. It's a little bit different than most people, because I was having leg cramps and body cramps. My legs were aching me terribly. I kept having charley horses, and I couldn't understand why am I having charley horses. I figured, well, maybe because I traveled. But I said, no, I travel often. I never had Charlie horses like that before. So after that, the next day, I started to have like body chills and fever. Then after that, you know, I was having a sore throat, coughing. So I said, oh, maybe my asthma is acting up because I'm asthmatic too. And so, so I was confused. I'm like, well, I know when I get these type of symptoms from living in Africa, I figured maybe I had malaria because I've frequented malaria many times and it felt like malaria. But I said, well, most Americans, they don't know malaria. So let me call the doctor. So I did a telehealth doctor appointment and they said, well, just go in and get checked and get tested because it's possible that you could have malaria. You know, I was coming from Africa. So when I saw the urgent care doctor, she explained, well, we'll do a test for COVID and we'll do a test for malaria. And they did all tests, all necessary tests that they normally do, but they did an extra malaria test and some extra blood work. And they also did a x-ray of my lungs because I was traveling to make sure I didn't have tuberculosis, you know, to rule out some things. So everything came back negative except the COVID. So I did not have malaria. I did not have pneumonia, but I had COVID. I said, okay, so what do we do next? So they called me and I got my results back in 24 hours. So it's not always that you get the results back in 3, 4, 5 days. So I said, I urgently need my results because if it's malaria, malaria can be just as dangerous as COVID. So they rushed the results. So with that said, I was isolated on April the 3rd, the following day, that same day, I went into isolation immediately because I have children in my household, myself and another adult. I have a lot of young adults. But then something else crossed my mind, and I told the doctor, I said, you know, my son, my 16-year-old, he was not coughing, but he was having a fever when we got for like 2 days. And then all of a sudden his fever just went away. So I'm like, maybe these young people are carriers. So I'm thinking differently now because why didn't my son get it and it didn't hold on to him, but yet it got to me? So it's possible. So when I read the studies and I read the articles, I'm very scientific. So I figure, well, there's something else to this than what they're saying because young people can get it, is what it told me. Even though my son didn't have it, he hasn't been tested yet, but I believe he have an antibody. And none of the children in my household, not one of the children got COVID. So that was very peculiar to me. Why did I get it? They didn't get it. They had fever for 1 or 2 days and the fever just went away. They were back to playing them natural cells, no coughing, no anything. So it's a very peculiar infection.
Yes, and you say that, we talked about this briefly on the call, and I've read this in articles, and Janel, maybe you can speak to this in a moment, is that scientists are seeing that COVID is changing, that it's behaving differently in different people, and it's taking on symptoms or characteristics that weren't previously identified as the markers to know if you have it or not, which means it's very important. You know, all the observations that you're making, Tina, the impacts that possibly your young people did have it, possibly they were just carriers. We've got to be vigilant, particularly in households where we've got young, older children, you know, multi-generational households where the risk for those of us who are older, particularly our seniors, is elevated. You were quarantined for a while. When you were quarantined at a medical facility and then you came home, what happened? You have to change or adjust when you got home?
Oh, wow. I was very, very aggressive. I was more aggressive before I left than when I went. And I became a stronger advocate for wearing masks, for wearing gloves, you know, from washing your body and your hair and your shoes and doing the necessary things to take every precaution you can do, even from washing your walls, you know, because they don't stress the chemical cleanliness of how you can rid the virus. And I think more stress should put on that because I haven't seen anywhere, even in Madison, Dane County, where you see people walking around with chemical spraying and cleaning public areas. You know, they're not doing it. They're not showing that. And I think that's part of the problem too, that in America, they need to do more cleaning, you know, more outdoor cleaning. If they're going to open places up, then you need to go and spray and clean the playground area. You need to go and clean the pools and, you know, do the necessary things. Don't just open things up and don't sanitize it. So there's no sanitation. There's nothing hygienic going on. It's just like reopen and bam, the disease is still there. It can live on metal for what, 7 days. It can live in fabrics, so it's there. And for me, I came to the conclusion that it's possibly is just in the air, basically, and you're going to get it. I just feel like at that point, everybody's going to get it, but some people are going to react and become, have symptoms more than other people. And some people are going to die because the time I was in isolation, I had a relative, my cousin passed away in Chicago from COVID. I had another dear friend of mine passed away from COVID, and I was very nervous because I had so much anxiety now. And I said, if I let anxiety overtake me, then it is going to kill me, because the anxiety alone and the fear alone can help you in a way that you can anxiety affects your immunity. So I was like, okay, I cannot allow myself to be, with so much fear and anxiety. So that was part of my self-treatment, was to think positive and to meditate and to pray, the whole time I was in isolation, because nobody was there to pray over me or lay hands on me. No one was there to comfort me, so you have to do all that for yourself because you're alone. And when you have that alone time, you're thinking about your family, your longevity, your contribution to society, what I should have done, could have done, didn't do, so all the things are going through your head, which also can build anxiety. I was having nosebleed. After the 8th day, my nose just started bleeding. And I'm like, I never have nosebleed. What is this? So I started to get concerned because my nose is bleeding now. And it just like, and so I did the old remedies where you just hold your head back, get a cold towel. So I was thinking of all the ancient things that our grandparents or your parents probably taught you, whatever it takes, whatever it takes. But one thing I know that my doctor agreed that in terms of my immunity, because I had dealt with infectious disease before in Africa, that maybe my body was a little bit more stronger for those type of infectious disease. After going through I had a bout of malaria, I dealt with many different diseases in Africa that I had to get through. And the other thing it affected was my stomach. And I don't know, Janelle, you're probably aware that it can cause stomach problems. So now I had a stomach situation where I couldn't eat. And what happened is I got the cramps in my stomach and I just passed out. I'm alone, mind you. No, there's no one with me. And so I get up and I'm like, oh God, this thing is affecting my gut, because now I can't eat, I can't hold food, and I didn't eat for I think I told you, Lisa, for about a couple of weeks. I couldn't eat solids. So now I'm losing weight, so many things start to happen. So as the disease progressed, other things come into play. And so I was like, you have to treat the symptoms of whatever is happening with that person immediately so it don't overtake the body. So I end up in not intensive care, but in an emergency room for those symptoms. And come to find out that I was having some situation in the stomach that the COVID was causing, but now my CAT scan showed that I also had a blood clot. Oh. I said, everything that is in the article is happening to my body. What is going on here? So as I speak to you now, I have a pulmonary embolism that I'm being treated for on a regularly, and I wanted to expose this information today and let you know the seriousness of the nature. I may look okay, I may look well, I may look strong and this and that, but at the end of the day, it left me with some elements that, that I have to fight through to still and struggle with, because a PE, as you know, is very, very dangerous. It's very dangerous. Yes. And so I'm being treated for that, which I could not get treated for it at the time because of my stomach. I don't know, Janelle, they said that blood clot create bleeding. It create internal bleeding. So they couldn't even treat me for that because they don't want to damage the stomach that the COVID. So I had multiple problems, from the COVID. So I'm just telling everybody out there, take this thing seriously. It's no joke. Even though I'm over the hump, I'm not quite over the hump. So and it's been 2 months. It's been 2 months and I'm still going through my healing process. I'm still taking it easy, watching what I eat, watching who I'm around. And one more thing, Lisa, I want to leave the audience with, they don't know if you can not get COVID a second time.
Right.
So I'm still taking precautions as if I never had COVID before.
Yeah.
You understand?
But Tina, what you're sharing today is what, by raise of hands, who is letting this information sink and right now, today, we have to guard our health. Yes, I'm seeing the hands waving. This is not it's not a joking matter, not a laughing matter. It's not something to be casual about. I'm hearing you tell me, Tina and Janelle, we know this from public health information, is that it lingers. You know, Tina can't say that she's healed. She can't say that she's over it. We don't know when it will be over. And the chance for contracting the virus a second time or a third time until there are more permanent means, vaccines, that's a whole nother conversation to have. And that has its own alarming implications for our community as well. So just pressing the message, we are by no means anywhere near being beyond the COVID-19 crisis, and our daily focus has to be being vigilant and guarding our health. We have a lot of questions, and then I'm going to ask you, Janelle, about the importance of masks with all the debate and all of the national outcry from some about masks. But Aaliyah, help us get through this, the massive questions in the chat.
Yeah, thank you so much for sharing. Folks are also just saying thank you for mentioning the emotional and mental impact. We needed to hear this, just how powerful your testimony is. And we're so thankful and grateful to God that you are here to share it and willing to share it. So thank you for that. The questions are largely around testing. It's a combination of questions, both for Janelle and for Tina, I would say. Our Facebook Live is interested in which country in Africa you were traveling from. And then for Janelle, there's many questions. One for Corinda asking, if you tested negative, should you be tested again? If so, how long should you wait? And from Mary to understand like the testing data around the census tract. Does it list zip codes? Can you find like literally like your location and how many rates of infection are in that area? And then lastly, from Cass, should we be getting the antibody test? So a myriad of questions around testing, around location of virus as well.
You want me to jump in, or Tina?
Sure, I can jump in quickly. I was in Cote d'Ivoire, West Africa, and Ghana. So Ghana and Cote d'Ivoire border each other. And I had a very long flight, so I had to do, because they was picking up many people and they were evacuating American citizens who wanted to return to America. So we had to stop in Ghana, Ivory Coast, Ghana, and Egypt. So we was in Egypt for a day also, and then New York another day. And so it was the route from West Africa to America. But the thing is, the countries I was in, they didn't have a lot of COVID. They only had 3, mind you. They only had 3 cases of COVID when I left that country. So there was only 3 cases at the time. So I know most definitely I did not contract it in Africa. I contracted when I got back to America. That's my take on it.
Thank you for that, Tina. Go ahead, Janelle.
Okay, I think I captured everything, but so from the census tract and the zip code data, so there's multiple census tracts in a zip code. So that'll give you a more detailed understanding if you look at that locator that the state health department has available to talk about where kind of the cases are identified as. We earlier on in the epidemic, we did not want to use that because we had so few cases that we were concerned that would make it very identifiable to potentially individuals, and we did not want to be able to put folks' personal information at risk. And I think that it's important to see when we look at that data by geography, you know, what is that telling us in general about what's happening, and also to look at, you know, and who may be impacted in testing and where it's happening. But I think it's also really important to look at it from that global perspective to understand that like this is everywhere. It's happening all over our community. We overlay that at different points in time with where we can identify folks are living and who is getting tested. And that will help us understand where we may need to make more, do more messaging around the importance of testing or make test sites available. in different community settings, and that's an initiative that we're working on and starting to roll out slowly, and anticipate that that will continue to build over time, because we know that the Alliance is seeing huge volumes, and we're happy that that's available for Dane County in many ways. I would say Dane County has more testing per capita happening than any place in the state right now. And that's great, because it helps us identify folks. So many people are asymptomatic, and where there's an intersection of testing that happens in healthcare that's largely focused on folks who are symptomatic or maybe going in for procedures, the testing capacity that we have out of healthcare really helps identify and support people in making, I'm feeling a little sick, I think I might have it exposed, and to get that testing done so that we can then start doing our work on following up with individuals to help provide them with the information, contact folks that they've been in touch with to help what I call, keep the boundaries tight. This is where it helps us start doing our job to be able to keep transmission from creeping out into the community. Did I capture? I think I'm missing a few questions. So
I sent them directly to you, but just talking about if you test negative, when should you go back in? And then questions around the antibody test.
Yeah, thanks. So I think if you test negative, I would, people are coming through the test, the Alliant. You might see from the data dashboard that there are more tests than individuals who are being tested, right? Or did I have that the other way around? The other way around, right? So what that means is folks can get tested multiple times. And I think that that's the important piece, that if you think that you have been in a place where you may have put yourself at risk, or perhaps not worn your, you haven't worn your mask, you've been in closer contact with individuals, than that 6 feet proximity for longer than 15 minutes, 10 to 15 minutes, then get tested, and that's okay to do. So antibody testing, I think, is important, and it helps us understand perhaps who may have had COVID in the past, but it doesn't tell us anything about the present, right? So it helps us build kind of a more robust surveillance understanding of what's happening in our community about COVID transmission, but it doesn't help us, if you get that test and you don't have the other test, it doesn't tell you if you have it or you don't have it right now.
This is all still very interesting. Janelle, I remember seeing an article in Madison 365 warning public that for folks who had been at the Juneteenth gatherings, and specifically anyone who had played one-on-one basketball that day on June 19th, that they needed to go get tested because someone there in the crowd had tested positive. And it is through the contact tracing that you're able to identify, the source of where the infection may have occurred. And I mentioned that to say, we're all connected to community. We all have families. We've got organizations we're tied to. We have community work that we do. But what do we need to hear about the seriousness and evaluate to participate in a public event right now when we know the risk of transmission is really near?
So I think that was to me, and you broke up a little bit, Lisa. So just let me make sure. I think I captured what you were saying. So we're all connected, right? And being in public, what is the risk and what we can do to prevent that risk of transmission? Is that being outside is always better than being inside, right? That is kind of a natural ventilation system, because this is a droplet spread. So the droplets spread largely for transmission of this virus. So kind of what comes out of our mouth when we're excited, when we're talking, when we're singing. We can produce more when we're kind of more excited, yelling, singing, things like that. Excuse me, and wearing masks and keeping that 6-foot distance, wearing those cloth face coverings are really, really, really the effective ways when you are out and you want to be in a place that right now we'll say is not prohibited or restricted by our orders, because we did just announce some new orders this morning, reducing the size of gatherings, because we are seeing that largely there's kind of the bar restaurant attendance, and then the things that I think we got a little bit, that quarantine fatigue around. And what's popping up in our contact tracing, I will say, is not protests. It is family gatherings, birthday parties, indoor gatherings, outdoor gatherings, and what that means is kind of like, oh, I was outside and then all the food was inside and I was maybe staying apart outside, but when we went in to get our food, we're gathering for a bit, and that indoor outdoor having an impact of where we're identifying things in our contact tracing. So, it's hard because we want to see those folks. And as you mentioned, Tina, right, like being alone when you're sick and not having that support just adds to the trauma and the social, emotional, and mental, health and well-being challenges. And it's just what's so incredibly challenging about this virus, because we know that there's so many things that are good for us, and those things that are good for our whole being are things that are also creating more risk of transmission and have the potential to make other folks sick. And how do we hold and balance that is, I will say, as the public health director, as a parent, as a family member, it's hard when you have to say, I can't see you, loved ones, and kids, you can't go anywhere. And yet those are the things that we really need to restrict and to think, many, many times about. And if we are in those situations, again, it's the wearing of the face coverings, trying to stay far apart. I've realized what my husband has said to me, how come when I come close to you, you back up? And I realized that it's part of it. Like, I'm starting to norm that just between us. And I'm like, I didn't even realize I was doing that. But I know that in this pandemic, right, I'm taking that seriously when I'm out in public for work or things like that. And I realized I was unintentionally doing that to him as well. I'm like, it's not you, it's just what it is. And so those are just those really important components of when we are out and about, to really be mindful. And don't go out if you don't have to go out. Do the takeout, curbside delivery, minimize, your trips to multiple places, and really consolidate your efforts.
Yes, Aaliyah.
Thank you, Janelle. We have a bunch of questions for you. So obviously this is a good conversation, a needed conversation. I want to go back a little bit to your question around, or the conversation around testing and the conversation around the Lion Energy Center. Just on Monday, my husband and my daughter went to go get tested at the Lion Energy Center and had a 3-hour wait time. I was looking at the data, and it's pretty amazing, the numbers. I mean, the National Guard is averaging one test every 20 seconds for 12 hours. I mean, that was the data on June 25th. So obviously, it's wonderful. We're getting tested. That's great. Those numbers in Dane County are fantastic. But I want to ask, is that a normal wait time? And I also want to inquire about other potential testing sites.
Yeah, thanks. Well, how did that wait time go? Oh, that's a long time. Yeah. For a 4-year-old, that was you.
Not the 4-year-old, not the 15-year-old. Yeah,
oh,
not
cute.
The 4-year-old.
Okay. So the last week is been longer waits. We have, I think, seeing the numbers go up, it is also driving folks to get tested. A large, I think at the beginning, quite a few of those folks were related to this young age group. And then I think it's also like, where have I been that other folks have been? And that's driving the numbers up. The wait time has been long. We have been, I will say, struggling with our National Guard state partners about getting an electronic intake system up and running. That should be live tomorrow, which should dramatically, it's something that we wanted from the beginning. I just have to say, like, it's one of the things that I was afraid would happen, and at this point we can't do anything about it. but it will be available starting tomorrow. And that should bring those wait times down quite a bit. We have asked for more kind of support because the National Guard is collecting the samples, but we also have a lot of public health staff and other city and county staff who are supporting that, effort. And so the National Guard, as of right now, will be at the Alliant Energy Center to help support this test site through April 7th. We're really advocating that they be here longer because our resources in this community are kind of drawing thin on how do we, where do we prioritize all these different equal priorities, and testing's a big one of them. Contact tracing another, making sure our healthcare system is another, and making sure everybody has the resources they need to stay well is, you know, they're all in the same bucket. We will be running the Alliant Energy Center through August 31st, concretely, very much quite likely through the end of the year. We're just building that staffing model. We know that testing needs to happen. That will likely be, I don't see it not happening. At the same time, I think, Aaliyah, you were mentioning, we are also looking into making a permanent test site available on the south side of Madison while the Alliant is up and running. A little bit more probably in the Villager Mall area, going back and forth on what's the right space there. And we, as you mentioned, we started this week at Orchard Ridge United Church of Christ, working with some that's the location, but working with different community led organizations to bring testing into communities, especially focused on communities of color, to make testing more accessible in ways that location is not just the only thing to make testing accessible. And we know that that is very important to us. We know that it's important to the community, and we want to work with community to keep that going. We have 6 more, I think 5 or 6 more sites identified right now. I don't have that list in front of me, but I can get that out to folks, and anticipate that more and more will be popping up in that kind of neighborhood embedded way, led and supported in partnership with maybe y'all, Lisa and Leah. We've talked about that. So just really focused on making it accessible in many ways.
I appreciate that. We have oh, I'm sorry, Lisa.
I just wanted to, oh, go ahead.
Y'all can hear me, and I want to apologize to everyone. We have new internet, and the connectivity on the new internet is not great right now. So forgive me, and let me know if I'm coming in and out. So many valuable things have been said. Janel, we will follow up with you. There is a lot of conversation about satellite sites for testing. I'm happy to see the increased trust that our community has now around going to get tested. We're struggling with these same questions as we're thinking about how and when we open our Black Women's Wellness Center, which you can see projected behind me. We meet as a staff once a week. We come in with masks. You know, there's some of us who've been around each other for weeks, and we know each other's profile and how quarantined we are. So we'll take our masks off at a certain point in the office to meet and talk. We were scolded by someone yesterday to say, you all didn't have your mask on in the office as you were meeting on the picture that you posted. And I want folks to know there were 5 of us, small group, who have been in each other's circle. We ask each other, you know, are you symptomatic? We ask about each other's comings and goings as a staff and a team, but it is a critical issue that you have to be vigilantly asking those questions about. And we're thinking about, you know, when it's appropriate to open, what are the measures we have to take in letting people through the doors of our office, which brings us to the mask question. And we've touched on it a lot. And Tina, I want to ask you in a second a question about that. We see national outcry. We see outcry here with people not wanting to wear masks, who feel like they're being discriminated against and that their civil rights are being violated for wearing a mask. And we have a couple comments of just consternation of driving down East Washington Avenue or University Avenue and seeing people unmasked in line, headed into public establishments, and even businesses who aren't enforcing it. why are masks so important? And I asked this in lieu of a call that we had with you guys yesterday, that Dane County will not mandate masks because we don't want to create unintended consequences for people, or to essentially, for African-American community, we've seen people approached and become the focus of police violence because they're wearing a mask, or cause of suspicion because a Black man is wearing a mask. It's a complicated issue, but the masks are for safety. What do we need to hear as a community about? Tina, I imagine it's frustrating when you hear people complaining about wearing masks. So Janel, what do we need to understand definitively about wearing the face covering? And then Tina, we'll segue to you as well. What do we need to hear, Janel, about masks?
The evidence is clear that mask works. Masks, I sound like my just turned 8-year-old. I'm gonna say masks soon. That they work, they work. We know more today than we did 4 weeks ago about how effective they are in minimizing the risk. They work best when both people or many people are wearing them. They work better. I mean, they don't work. It doesn't. If you're not wearing them, there's no help. If you are wearing them, we want the other person that you're with to wear them. You're protecting them, they're protecting you. And that's how we need to think of it as a community. That is absolutely clear. And there is a huge outcry by some folks in the community about making them mandatory. And we want to really, really, really think through it from the unintended impacts, and the conversation that you mentioned, Lisa, that you were part of yesterday. I unfortunately wasn't able to be part of, but I'm glad that it was had with public health and leaders of color and folks around the community around the conversation about how do we build understanding, messaging about the importance of wearing cloth face coverings, and how do we think about those unintended impacts that are putting some folks at additional kind of risk and burden than other folks. So
wear your masks. Wear your face coverings. In fact, the foundation is about to order a bunch of face masks to share and to distribute to folks, and we'll let you know. And Janel, I'm assuming a question that came up yesterday is, where can communities access face masks? If there are community centers or community groups or organizations that have access and ability like we do to get masks out to the general public, are there any provisions to providing those for us to distribute?
Yeah, I am pushing on that, and I hope that we can have some type of announcement around that sooner rather than later. I know it's important, and I've asked for some support from other colleagues in government to help make that accessible and to work with communities on how do we make, that's the critical piece. It's not just the understanding of the importance, but the ability to access them, and how do we make them accessible. So absolute priority.
Yeah. I just wanted to comment, because to me, wearing a mask, what I tell people is a matter of life and death. I'm not going to sugarcoat it. It's a matter of life and death. If you wear a mask, it's the best thing that you can do. People tell me, oh, Tina, but you had COVID already. You're a survivor. Why are you wearing a mask? You're more safe than everybody. No, I'm not more safe than anyone. Like I said, I go as if I never had COVID. So I continue my hand washing. I continue wearing my mask. I continue quarantine as best as I can. People coming in and out the house, they're like, you always, I'll wear the mask in the house when people come, because I don't know what you're bringing in. We don't know enough about this infection, about this disease. We just do not know. So to me, precaution is better than no precaution. So you have to wear a mask, and the governor, I think if it comes from the top down, they have to continue pushing it. Unfortunately, our president 45, he didn't have, that's another story. But I think for as far as Wisconsin state, we can still control the situation. So by implementing the mask wearing, the hand washing, the different things that we need to do. I mean, even when you go to clinics sometimes, you don't even see clinicians wearing masks. And this freaks me out. I'm like, you're a clinician and you're not wearing your PPE. So you see a lot of things that people are just taking for granted. You know, they're taking for granted. They're being like, I don't know. I don't understand it. But for me, because it almost cost me my life, yes, I have to say you have to wear a mask because it can be anybody. You know, people are carriers. They don't know if they're carriers or not. You don't know what underlying disease people already have. You don't know if they have diabetes. You know, you don't know. So me wearing a mask feel like I'm protecting somebody else. You know, my granny, my elder sister, my elder brother. You know, so it helps me to feel okay that they will not contact it from me. Whatever happened, they're not going to contact it from me. Maybe they'll contact it somewhere else, but I'm going to do every preventive measure that I can take to see to it that I'm not a carrier and I'm not giving it to someone willingly. Because one thing that I learned when I was in a medical facility, and I asked the U.S. National Guard person, I said, you know, you guys got to really lay it out here. You know, I mean, in terms of security and protection and wearing the mask, because they wear gas masks actually, but they were very, very fit. So I said, if, you know, and I said this, and I thought about it, and he thought about it. I said, so I'm sort of like a weapon of mass destruction. He said, yeah, basically, you are. I said, okay. So this is how extreme this thing is. You know, for one person to have COVID and have the symptoms, you can go around and infect many, many people. Look at the numbers exponentially. Thank God I didn't infect my entire family. I just keep saying it. And that's why I reached out to the Black Women Wellness Foundation, because I said, I have to know that if something happened to me, that somebody, an organization in the community can help me, because I can't account for what's happening in my household because I'm somewhere else, but maybe they can bring together a community and say, okay, Tina, we can reach out for you. You focus on getting well, and we'll see what we can do on this end to help that person in your household while you're away, you know, to fix some things there in case something happens. So that's how Lisa and I got connected, because I was just like, you know, freaking out because what about my children? They're on quarantine. They need food. They need this. And so Black Women Wellness was able to coordinate that for me. So we need some type of organization also. And I hope next time you can stress on that we get a list together so people can know the resources that are available to them, that even if, you know, you can't get medical, you can get some social help or some type of, you know, platform that can assist you while you're being in quarantine. You know, so I just wanted to make sure that I bring that out. And also the City of Madison Public Health, they were like awesome. I'm telling you, logistically. And me, I'm very complaintive when it comes to these things. You know, I learned that from Mama Malele. So they were very logistically doing what they had to do, because I said, no, you guys have to do this, you have to do that. And even when they got lackadaisical, I had to go there and say, you know, I'm African American, and you know the statistics. And me, I want to live. I want to see my children graduate from high school and college and see my grandchildren. So this is what we have to do. So they were able to logistically get me out of my household, get me in a medical facility. When I passed out, get me to emergency, get me to the ER. And see, these are things that the infrastructural things that we have to remember. So you just can't say, oh, forget the state, forget the city. No, because they have a major part to play too. And I feel like with all of us, with them, with me, you know, all these different organizations, that helped me to get that stress off of my mind and that anxiety, and my anxiety came way down. Now I can focus on my healing and say, okay, now I can go to the next phase. I know the Black Women Wellness is going to take care of this for me. I know the City of Madison is going to take care of that for me. You know, so you guys' job is very, very important as well. So I just wanted to make sure I got that point made, okay? Oh. So keep doing what you're doing is what I'm saying.
Tina, it is our honor and has been our honor to be here for you. And it is more honor to have you on this call. People are asking for a part 2 next week, and just saying how vital this discussion is. We also apologize to folks who said some of their invites said that this meeting started at 10.
Oh,
folks were, and now we understand why. I have that my sound, Leah.
Yes, we apologize for our timing, but thankfully this is live and recorded and folks will be able to access it. Again, people are asking for a part 2. People are really excited about this information. We have many more questions left in chat. I realize it's 10:02, but since we started a little late, I'm figuring that we can go a little over. So we have a great question for, from Beverly for Janel. This is so important. This conversation is so important and so rich. We're all being enlightened. We're all getting detailed information and being able to ask our questions. On a larger scale, where is this detailed critical information and advertising happening?
So I guess maybe what's the detailed information in advertising? Just this information for me that I've shared today? I mean, we are, clearly if you're asking, we're not getting it out wide enough. But we are trying to build messaging in a variety of different ways. And social media, our Facebook, our website, please come. We have so much information on the website. We're trying to make it available in a couple languages. We have folks that can talk to you over the phone, answer your questions via email, and are knowing, I mean, we are 5 months in, it feels like 5 years, and we probably have 12 to 18 months left in this. And so we are constantly evolving in how do we message to whom, with whom better. So I will take that question into heart to see how we can improve and amplify. And I think that was part of our conversation that happened yesterday around face coverings, is just how do we ripple effect and make sure that trusted messengers are getting information out into communities and not just from us, is something that we know is very important and we'll be working on as well.
Thank you. And I'm assuming, and Beverly, correct me if I'm wrong, in the Beverly was just mentioning maybe social media, maybe an app. I'm thinking more directed. I'm guessing that Beverly's talking about more directed with particular communities that are most impacted, like the Black community. So I have so many questions popping up, continuing to pop up. We talked about like the need and desire for people to connect, and you know, the kind of the fatigue. I love how you phrased that, the COVID fatigue of staying isolated. What are your recommendations? Number one, if we have family visiting us, do you have to be a Wisconsin resident to go to the Alliant Energy Center to be tested?
No, it's open to anyone. We're not turning anyone away. We want people to get tested. I think using your example, if you have someone coming, you know, something to do, the timeline of getting the feedback could be 24 hours to 5 days. It has lasted longer at different points in time. If you're negative, it might take longer. If there's some data glitches, it might take longer. Those aren't largely in our control. In Public Health Madison, Dane County, once we get your name, we'll be in touch with you as soon as we can, and that's usually 24 to 48 hours. But I think the question related to if you're having family and friends come and they haven't been tested, you can get them tested, and then I'd ask you to think about how you want to interact with them until you find out what their results are. You know, how do you wear the mask around grandma and the face covering, and really just because they're your loved ones, if they haven't been in your quarantine circle, bubble, whatever we want to call it, think that they may have exposure that you haven't had. And we are seeing more recently, I think, with some of that fatigue, and I've heard anecdotally, we've had a lot more of our younger folks coming back to campus, whether it's from outside of Dane County or from outside of the state. More recently, which could have an impact, that travel is having an impact on what we're seeing as well. So there's different exposures, or there's different kind of rates of transmission from around the country. Thank you, Mary, wear your mask, wear your face covering. And
Janel, can you talk about that travel, and can you talk about airplanes and the relative safety?
Sure.
What are you finding about that?
Yeah, well, you know, trains or airplanes, any place that you can't really maintain that 6-foot social distancing is probably going to put you at greater risk. And you can wear your face coverings, but travel is going to put you into more places that are going to come into contact with more folks. And that just kind of further kind of erodes your bubble, I would say. And so unless you really have to, my recommendation would be don't really do it. Or if you have to, think about the way in which you do that. You know, is it a
High
way in
risk.
which you can
It's high risk.
it's a higher risk situation. That's exactly right. And if you have to travel, can you do it in your car? Can you only stop and fuel your car and not come into contact with other folks and plan ahead? And that would be my recommendation right now.
Okay, thank you. Do we have time for one more question, Lisa, or? Yes, okay, Lisa said yes. So Lisa kind of opened the call talking about the conflict that we have between like the economic need to return to work and the safety, the relative safety of being at work and being exposed to individuals depending on our job. Chelsea asked a great question. What is your take on returning back to the office? So there's already, you know, there's some concern about that. And she talks about her employer gave her a deadline and saying that 50% of the workers need to be back. She's already been in contact with her doctor, but is there any advice you can provide on the specific reasons while following CDC guidelines?
So I think if you can work virtually, because we have put out an order, and I think there's something that we can work on better in our messaging. I think when people might hear or see that we say it's a 50% capacity, you have to go to 50%. You don't have to go to 50%. You could still be at 5 or 10. It's no more than, right? And that's, I think, an important takeaway, and that continuing to work remotely, if you have that opportunity to do so, and I know that not everyone has that, is the preferred way to continue to work. I would also say we have tried to put some requirements in our orders to build in protections for employees of sectors that are inherently more high risk, and for everyone in general, but really to support that physical distancing and face covering option, and or if you can't maintain that physical distancing, and if you know, and things like that. So if you have the ability, and to consider the needs of your employees is something we can always do, but we can amplify that message around. Like, if we don't want high risk folks coming back to the office, that's not the place, or wherever it is that you work, if that, but not everyone has that opportunity. And I think that's the balance, right, that we are struggling with right now in this global response to COVID.
Well, I just want to say that I'm taking my time. I'm healing. It's been 2 months. It's been 2 months since my COVID. I'm still having a few complications, but I'm trying to remain as positive as possible, you know, because I'm dealing with the clot, the blood clot situation now, and I have to get, you know, tested to make sure it's dissolving, you know, things that I didn't anticipate, you know, and I still have a little chest uneasiness where I cannot even wear a bra. You know, it's difficult to wear a bra across my chest because I'm like trying to breathe, you know, to make sure that I can breathe. So there are ongoing complications. So I just wanted to stress the importance again, why we should wear the mask, you know, and why it's important to wear the mask, why it's important to social distance. And we have to really, really push that. You know, we have to really push it. And I agree, Janel, in terms of travel, because I feel like I contact mine on the airline travel. And so I don't push people to travel airline, but if you can take a road trip, I would say road trip is better, it's more safer. You have more control of your environment. You can wash your car, you know, spray it. If you go into a public restroom, you can be more, you know, you have more control of the situation. Where in the airplane, you don't have control. You're just there with everybody. And there's no social distancing on the airplanes. So if people are going to travel, just keep that in mind.
Yes, you all, we are at time, and we are so grateful for this conversation. Tina, you really closed it out for us, because I was going to come back to you and ask you your closing comments to everyone, and those were beautiful. But first, let me say, we celebrate your life. We celebrate your life, Tina. And we are all sending healing energy your way, and we are claiming with you and for you that there will be complete healing, and those clots will dissipate And you will be fully restored. We believe that today, and we thank you. You are looking so radiant. I really love the point that you made, that it really isn't about how we look.
How you look, you can look well,
Look
but
radiant.
thank you.
But we have to be vigilant, and we thank you for your time. Janelle, we thank you so much for your insights. People are so appreciative in the chat for this session. Even those who joined late have asked, will it be recorded? Yes, it's recorded. We can send it back out to you. You can always also see all of our morning coffees replayed on our Facebook page. All of the live video stream is there at facebook.com/Black Women's Wellness Day. So go there. Raise your hand if you do want a part two, if you want a part two. Yeah, we heard that a lot. And so we will make that happen. We beg you all, we beg you in every way out of love to guard your health. You know, guard your health, that's number one. I loved how you said, Tina, that when you're alone, you're thinking about your life, what you should have done, could have done, your future, your impact, your contributions to the world. We can't do any of those things if we're not here to do it. And we have the power to protect our lives with information. And we thank you and Janelle for giving us life-saving today. With that, and if my sound breaks up, Aaliyah, how about you close?
Yeah, I'm gonna have to close out. So again, please visit www.publichealthmdc.com for updates to stay safe and informed. I'll put that in the chat as well. And then also, just a quick shout out, we will be having our 12th annual Black Women's Wellness Day in September. It's going to be a 2-day virtual event. We are excited and turned up about it. Be putting information on the registration will be opening soon. Please attend. Yes, thank you, Zakia. Yes, we're fired up. And lastly, we just want to leave with Lisa's parting words. Yes, Mary says, get your Black Woman Wellness or Black Woman t-shirt as well. Yes. But we want to impart with Lisa's closing words, which are know thyself, love thyself, heal thyself. Our wellness starts with us and we have the power. And with that, remember, be safe, be healthy, be well, and we'll see you very soon. Thank you so much.
Thank you.
Bye, everybody. Bye.
Thank you.
Thank you.